Tara, would you like to tell me when we're ready? Everybody ready? Good morning. This morning first, I know we would all like to acknowledge our sorrow at the tragedy of the loss of our Washington State Patrol Trooper, Justin R. Schaefer. I know people's hearts are with this family and the whole community in the loss of this proud trooper. You know, our state troopers, our nurses, our physicians, our grocery workers, they are protecting all of us at the risk of their own health right now. And in our own lives, as we struggle with some of the challenges we now have individually and as families, I hope we can keep in mind all of the people who are protecting us around the state. We appreciate their heroism, and we hope to match it with our commitment to stay home and stay healthy. As of midnight, 11 hours ago, our Stay Home, Stay Healthy order has completely gone into effect. And we are convinced that over the next 2 weeks, it will aid us tremendously in lowering the trajectory of the COVID-19 infection rate in our state. With more than 4 million registered businesses in our state and even more workers in various industries, my office and cabinet agencies have received many requests for guidance from people and businesses that want to be in compliance with this order. And I am very pleased at the response so far that people very much want to be part of Team Washington in this Stay Home, Stay Healthy mission. We really appreciate that. If people do have questions, we direct it to coronavirus.wa.gov, G-O-V. That's coronavirus.wa.gov. And it is both my intention and direction to state agencies to be helpful and patient with anyone who is trying to comply with this order. And my office and other agencies, as well as stakeholders, are partnering with and want to make sure that we clearly communicate with all Washingtonians in this regard. And as I've said, so far, we have seen overwhelming compliance, and that is to be expected, I think, because Washingtonians know what it is to work together. We know what it is to overcome challenges, and we know what it is to take a little hardship for gain over the long run. There are also some exceptions to our orders that will help people stay connected, and staying connected is important. For example, religious institutions can have, under our order, a certain number of people present at the places of worship to ensure that online remote services can be afforded to their flocks. You know, anxiety in our state is understandably high right now, but I do want to reiterate, we may be hunkered down, but we are not locked down. You can leave your house for a walk. You can go for a drive. You can do things essential to your livelihood for these essential industries. We do want you to limit those activities in ways that make common sense, however, and it's probably not a good time to be driving across the state of Washington. It's time to hunker down closer in our neighborhoods. But there is urgency in this effort. We are fighting the same pandemic in every corner of our state, but it's being felt in different ways. I've heard questions from some residents in communities that are not in King, Snohomish, and Pierce County. Those are the states that have been hit the first with this virus, and some may think that action is not necessary outside of those counties. But the unfortunate reality is that today this virus is spreading across the entire state of Washington. And its method of transmission is simple. It is person to person. And whatever we are seeing in Seattle today could be in Walla Walla fairly shortly, in Port Angeles, in Centralia. And so it is very clear that all of us really need to bend our shoulders to this task to save the entire state of Washington. The virus's devastation in some parts of our state is the kind we're desperately trying to halt in the rest of the state. So it is crucial that each and every one of us across the state maintain the social distancing that we know is our only weapon against this scourge. We are only in the first 2 weeks, and people need to understand this. This order may need to be extended. And the reason is we simply cannot allow this virus to be slowed, but then spring back upon us. We've got to pound it, and we've got to pound it till it's done. And I'm glad that Washingtonians are pitching into what is really a warfare against a fatal disease in our state. So this is a pause that will allow us to evaluate the progress that we are making to then determine next steps. Now, we do believe we are seeing some encouraging signs in the Puget Sound area, including progress on support of those experiencing homelessness. The FEMA Region 10 administrator has told me that additional facilities in the way of field hospitals are on the way for boosting our hospital capacity as the number of patients in our system increases. Brigadier General Peter Helmlinger of the Army Corps of Engineers has told me that they are now looking at sites in the state to add additional hospital surge capacity. So we are appreciative for this federal medical assistance because it is necessary to prevent our healthcare system and our workers from being even more overwhelmed. We also have fairly shortly, we hope in days, 146-bed hospital, field hospital coming, I believe, from Colorado, from the U.S. Army, for which we are appreciative. And that is not the end of our surge capacity. As you know, Dr. Raquel Bono is now coordinating our surge efforts with private hospitals as well, and I think that is now a well-coordinated effort. We've ended elective surgeries to free up capacity, and we are now looking through the entire system for our medical equipment so that it can be distributed and given a priority where it is most effective. We've conducted more than 31,000 tests in our state, but we have very significant unmet needs in testing. And that is why it is so important for the federal government to increase its support for testing materials. I spoke to the President and the Vice President about this issue this morning, and so we need to continue some efforts, dramatic efforts, to increase testing capability. We have received significant shipments of personal protective equipment for health workers from the federal government, and we are appreciative of that. And I appreciate the federal government's efforts on many fronts in this regard. However, I do have profound long-term concerns about being able to procure these necessities. The state has been purchasing additional equipment from private vendors, and we have received donations, and thanks to everybody for that. We already cannot meet the demands coming in from around the state, however, for these critical supplies. Our state Department of Health, just to give you a feeling of how we're trying to solve these problems in real time, last night had an employee drive across the state of Washington from Shoreline to Spokane to pick up the vials that are needed to take the samples to send to the testing labs to deliver them to Yakima last night that had a critical demand. And I think this just illustrates the critical shortage we need, and we need the full energy of the manufacturing capacity of the United States of America to become engaged to manufacture these supplies. And we need a national system of procurement. That is the only way that we are going to get our national manufacturing base fully engaged in supplying what our local communities need. And it is the only way that we will be able to set priorities about where these crucial supplies can be achieved. Today we are in a mad scramble, frankly, with 50 states competing against one another for crucial supplies. Now, I've been talking to people with connections myself in China looking for these supplies, and I know other governors have been in the same position. So we need additional federal help, and we need a federal system to be able to be effective in this regard, just like we used in World War II. And I would note that in World War II, the battleship, the Missouri, that we had for years in Puget Sound, was not built by the state of Missouri. And that's the approach we need to take for the federal government to become totally engaged. Now, I do have some hopeful news. We know that this is still a dire challenge. We know this is a fateful disease. We know that we have not turned the corner, and we are not even close to the end of this battle. But we do think there's some evidence that our community mitigation strategies, the things we've done already to close schools, to close restaurants and theaters, to prohibit gatherings, we think these things have been able to slow the rate of increase in King, Snohomish, and Pierce counties. And if you'll look on your screen, I'd like to make a reference to this graph. If you look on the graph you're seeing, there's a blue line that basically tails off and down towards the end of the blue line. And this graph demonstrates the number of diagnosed infections over the last couple of weeks from an equivalent start date for wherever the state had, a particular state had about a certain number of infections, 20 infections. So this basically puts all the states on the same starting point when they had 20 infections. And then it totals the number as it goes forward. So what you're seeing is that our line has gone up. Bad news. And fatalities have continued to increase. But if you'll look at the line, it has some slight reduction in the rate of its acceleration, the curve, the level of curve. And we've all heard about turning down the curve. This graph shows a very slight lessening of the rate of increase by looking at its curve. It's a small reduction of the rate of increase, but it is a glimmer of hope. And the reason it's a glimmer of hope is that this is suggestive that some of the things we're doing together is having some very modest improvement. And that ought to give us an additional commitment to the things we're doing today, because the things we did 2 weeks ago are now appearing in our hospitals, and we want to continue that effort as well. Now, I want to reiterate something about this graph. Do we still have the graph up? Yeah, we still have. I hope the graph is on the screen. Thank you. We need to understand this. This is very important. We cannot let up on this virus even if we get to a point where there's continuation of reducing the rate of increase. And we eventually want to see these numbers start to drop down on a weekly basis. But the fact is we have to hammer this until we can be assured that it will not spring back up. And so we will not be able to be confident that we can release some of our joint efforts in the state until we're very confident of that. Because it will not be successful to have a success these first 2 weeks and then give up with all of our efforts and have this thing spring back on us. We need our economy to come back as fast as possible. And the way to do this is to eliminate this virus in our state. So there's more work to be done. And we need testing, pervasive testing, before we'll be able really to return to normalcy in our state. So our economic response moves on as well. This morning, the Department of Commerce announced $1.8 million in grants to rural Washington counties for a COVID-19 response. We are allowing retail stores to sell goods online and mailed to customers. And I want to reiterate, they need to be mailed or somehow delivered in a remote fashion. We just can't have people crowding around the doors of our retail outlets right now. This week, I also authorized extended notary services and waived late penalties on tax payments from businesses to the Liquor and Cannabis Board. And last night, the Congress passed a stimulus bill that will provide critically needed support to workers, families, businesses, and hospitals across Washington. I want to thank the Congress for acting on this, and I want to thank the President and Vice President being open to our communications as we have gone through this. We appreciate the opportunity to talk to both him and the Vice President. But here's why the stimulus is so important. We have seen an 843% increase in new unemployment claims in just the last week. 2 weeks ago, the state received 6,000 unemployment claims. This week alone, we have received 133,000 claims. New claims are 5 times faster coming in than they were at any time during the last Great Recession. So we have seen nothing like this in our state's history, and as a result, our Employment Security Department is bringing on hundreds of staff to meet the public's needs. Now, we also want to thank the Congress in this stimulus bill. It has significantly expanded both access and the amount of unemployment insurance people will get, both to expand the number of people who are eligible so that part-time workers will now be eligible even though they don't have 680 hours. Some folks in the gig economy will be eligible, and the amount of the checks will also increase, and we think that this will be helpful. I want to remind folks that we are moving forward with a plan to make sure that older workers over 60 and those with health problems, even if they're in an essential business, if they feel for their health that they should stay home, they will have access to these benefits. That's a very important point. We're still trying to determine whether I can do that through executive action or whether I'd have to call back the legislature to get that done statutorily. I want to reiterate that our employees are going to be working really hard on this. I wish we could all tell people that checks could go out at noon today on that, but I think people realize it's going to be some period of time till we can get this system up and running for this huge expansion of needed help for people. So we have a lot of work to do in this regard. Our COVID-19 cases continue to rise. As of Wednesday afternoon, our state has 2,580 diagnosed cases and 132 deaths. Of those who have died, more than 90% were above the age of 60. Half of those Washingtons were over the age of 80. And I want to just take a moment to again ask all of us to wrap all our loved ones in our arms, but a special huge embrace to those over the age of 60, to those who have some underlying health care concerns. We all, I mean, if you're a 25-year-old today, I think the single most important thing you can do in your life is to call your parents and grandparents and make sure they're not going out, make sure they're not bringing the grandkids in to wrestle with, and make sure that every morning they wake up and figure out how they're going to enjoy their life at home. I think that's the most important thing we can all do right now, because these are the Washingtonians who are most at risk. Now, we are having fatalities of younger people, and that's why younger people, for their own protection, have to follow this social distancing as well. But this is a moment to care for our elders. I cannot overstate that. Now, we want to get back to life as we've been used to, and economy as we used to. And the faster we all turn to this right now in the next 2 weeks, the faster we're going to get to those bright days. And I'm confident that we can do that. I just want to note the other thing I feel good about is that how people are realizing that while we have to be physically unconnected, Washingtonians are understanding the importance to be emotionally connected. And I'm just hearing so many stories of families and friends who are really having great relationships electronically. And I know we have to be creative, but we know that can work. I just want to put up on the screen, I've got a screenshot of a FaceTime meeting that our 4 generations had yesterday. You see in the left-hand corner, that's the newest Inslee, Annie Hazel Inslee. And in the middle is Trudy Inslee, that's Annie's grandmother. To her right is Trudy's mother, Trudy Tyndall, who is 102 years young, and you can see the great time she's having with new technology. And her comment about that FaceTime was, wow, this is so great that people invent new technology. She had a good time. Above her shoulder is Bonnie. She's in Wenatchee, Bonnie Tyndall, her daughter. And up in the right-hand corner are three rascals in Kitsap County, our grandkids. And I hope that this is being replicated so we can all be enjoying each other's company. And I know people are doing that. I'm loving to see here Washingtonians playing on the ukuleles and all the creative artwork they're doing. This is a time we can be together, and I know we are. So with that, I'm happy to stand for questions.